aortic stenosis, just to remind you, the aortic valve is this main valve which separates the heart from the rest of the body. And this valve can get very diseased. It can get very narrow with lots of calcium deposits over the years. And it can prevent the valve from opening. And it can also leak. This valve can also leak in some people and give the same problems as the mitral valve. So unfortunately, with the aortic valve, it's not so good to repair the aortic valve. It is better to replace the aortic valve with a new valve. And so what we can do is we can remove the diseased valve, and then we can suture a new valve in place to replace the diseased aortic valve. So patients with aortic stenosis, typically they get very short of breath. They can get also chest pain because in this condition, because the blood is unable to leave the heart, very often not enough blood is able to flow to the coronary arteries. So these patients can present as if they have got coronary disease. They can get symptoms of chest pain. And they can also faint. They can also lose consciousness because there's not enough blood reaching the brain and the rest of the body. This condition is quite serious because, as you can see here, so this on the y-axis is the percentage of patients surviving, and this on the x-axis is the number of years. And you can see that once symptoms develop, symptoms of chest pain or fainting episodes or shortness of breath, if we don't do anything, then you can see the patient very rapidly deteriorate and they pass away within a few years. So this is a condition which really we cannot wait once we have diagnosed it, and once the patient has got symptoms, we really have to do a valve replacement quite soon. And so if we compare those who have valve surgery, valve replacement surgery, with those who have no surgery, we can see that this is survivor, how long the patient lives. You can see the great difference that those who have valve surgery will live a lot longer than those who do not have surgery once they are diagnosed with this condition. So there are two types of valves we can use. One is a tissue valve made from animal tissue, usually in this country made from cow tissue, bovine heart valves. And this is an example of tissue heart valve. These valves do not last forever. They have a limited durability because of the wear and tear. If we put it in a patient 70 years and above, we can see here, in most of these cases, up to 15 years, the valve is still good. So usually in patients, in the older patients, those who are above 70 years of age, we would recommend a tissue valve. But if we put this valve in a younger patient, in those, for example, who are 50 years of age, you can see that the valve do not last as long, lasts about 10 years. And after that, we have to replace the valve again. Having said that, new valves have come about. So this is one of the new valves, which should last longer than that. So potentially we can start using a tissue valve in younger patients. But even then, we still want patients who are younger, that if we put in a tissue valve, they are likely to need another operation at some stage in the future because the valve may not last their lifetime. But if we put it in an older patient, 70 years and above, then in most of these patients, this valve is good enough for the rest of their life. So in younger patients, we have the option of a mechanical valve made from metal, and this can last the lifetime of the patient. So this will last longer. The only disadvantage with mechanical valves is that they need to go on a blood thinning medication called warfarin. And with this medication, we need to monitor the blood tests at least once a month or once every 2 months to get the right amount of medication. Because if you're on too much of this warfarin, then it can cause bleeding. If you're on too little of it, then it is not doing the work. It can run the risk of clots forming on the valve. So there is a disadvantage with mechanical valves. You need to go on blood thinning medications. With the tissue valves from animal tissue, you don't need any additional treatment, but it doesn't last more than 15 years. Nowadays, we have a newer uh, device, what we call the transcatheter aortic valve implantation. So we can replace the aortic valve without the need for conventional surgery. So we can actually make a small incision in the groin, and then under X-ray guidance and imaging, we can push this new valve up the aorta, the this main blood vessel, and then position it just where the aortic valve is. We can then stretch the aortic valve and then deploy this valve where the narrowed aortic valve is. So this is a new technology called transcatheter aortic valve implantation. It is a very new technique, and because of that, we do not have long-term results from it. So we are recommending this technique for the older patients and those who have a lot of other medical conditions which will significantly increase their risk of conventional aortic valve replacement surgery. So in those who we feel that the risk of a normal aortic valve surgery is too high, then we can advise this newer treatment option to replace the aortic valve. But for most of the other patients who are younger and in whom we expect to live many, many more years, we would still recommend a conventional aortic valve replacement because we know the long-term results from a conventional aortic valve replacement. So if we compare the survivor, how long patients live after they've had a surgical aortic valve replacement, that is, patients who had an aortic valve replacement through the conventional technique, versus this newer technique, what we call a TAVI technique, transcatheter aortic valve implantation, we will see that in the first year, patients who have had this new treatment with TAVI, they live longer. So the new treatment is better than the conventional surgery in the first year after treatment in terms of how long the patients will survive. Between 1 year and up to 3 years, you can see there's no difference in survival. So those patients who have the conventional aortic valve replacement and those who have this new TAVI procedure, they live just as long. But beyond 3 years, you can see that this blue line are those who had TAVI, the new procedure, and this red line is those who had the surgical aortic valve replacement, and this is the incidence of patients who have died. You can see that less of the patients who have had the surgical aortic valve replacement have died. More of those who have had the new TAVI procedure have died after 3 years. So it appears that beyond 3 years, the standard aortic valve replacement through the conventional surgery is still the better option compared to the newer transcatheter aortic valve implantation. And that is why we still recommend the normal aortic valve replacement for the patients who are lower risk and in whom we expect to live a very long time. But for the more elderly patients, the older patients, and in those who have a lot of other medical conditions, which will increase the risk of open surgery, then we would recommend the transcatheter aortic valve implantation, or what we call the TAVI procedure. So the take-home message from this is that patients with symptoms due to severe aortic stenosis should undergo aortic valve replacement surgery, should undergo urgent aortic valve replacement surgery. I'd like to thank you again for joining us today, and thank you to CVSKL and to our supporting partners for arranging this webinar. I hope it's been useful and interesting, and I will be happy to answer questions. Thank you.